It is 8:30, so we will begin. Good morning, everyone, and welcome, and thank you for joining us today at this important conversation. I'm Megan Manahan, the Chief Brand Officer of ThedaCare, and I'm happy to be with you today and lead us through this discussion. And it's clear that we must move urgently forward safely together. Given the number of individuals on the call today, we're asking that you put any questions that you have in the chat box, and we will answer them at the end of the meeting. If we don't get a chance to address them all, we will address them in further communications after the call. So Heather, if you could pull up the deck, begin to walk through. So we are happy that we have a lot of people on the call today, and we do have a full agenda. In addition to the speakers from ThedaCare, which include Dr. Imran Andrabi, President and CEO, Doctors Mark Copley, Chief Clinical Officer, and Michael Hooker, Chief Medical Officer of Acute Care at ThedaCare. We also have several esteemed guests. Becky Bartosik, the President and CEO of the Fox Cities Chamber, Judith Baseman, the Superintendent of Schools for the Appleton School District, Kurt Egebrecht, Health Officer from the City of Appleton, and Tom Nichols, Vice President of Medical Affairs at Ascension, St. Elizabeth. So we very much value their expertise, and we thank them for joining us today. So I will now turn over to Dr. Andrabi to begin the meeting.
Thank you, Megan, and good morning to all of you. I hope you can all hear me well. For the last several days, this has become what I do. Day before yesterday, I had an opportunity to have a conversation with the governor and Andrea Palm, our Secretary of Health. Yesterday, I was with the legislature from the Republican Party having this conversation. And what I'd like to bring to all of us this morning is a sobering conversation that's an adult conversation and a leader conversation as well. It is important then that as you go through the day or this meeting, that we listen to the different perspectives under the banner of Be Safe Wisconsin. We get to understand the why and what's happening and the implications of that. And then obviously at the end, let's talk a little bit about what do we need to do to make it different. I'm not going to go through a lot of stats with you. You all see them in the news, and Frank Mellon is going to go through some of that statistics with you along with some of the other folks on the call. But it is very sobering when we hear that the death toll from COVID took a huge spike yesterday with the largest number of people dying in one day. It is also very sobering to hear and to read and listen to the fact that majority of the hospitals now in Northeast and Central Wisconsin are at 95, 97% of capacity. And one of the hospitals quoted in one of the newspapers yesterday is talking about wait lists for patients to get in. I just want to pause there for 3 seconds and let that sink in. I'll share a story with you that I heard yesterday, where an ICU nurse comes to one of their leaders and says, I'm in the ICU 12 hours, 14 hours a day in full regalia of personal protective equipment and changing that personal protective equipment between patients so I can keep my patients safe. And then at the end of my shift, before I go home, I go to the local store, grocery store, whatever it might be, and I see people not masked. And then I say to myself, they call us healthcare heroes. And then when I get infected, who's going to go take care of the patients that I've been taking care of? And the reason I share that with you is, and I'll just talk for ThedaCare, and you can probably hear it from other people, is that the greatest number of exposures to our team members at ThedaCare are coming from the community. Yesterday, I had more than 250 people not show up to work. And when that happens, all of those people cannot be serving the people we are here to serve. So it is not fun to be on the top 5 list in the country of the states that are having a tremendous surge in cases. It is not fun to be in a situation where every day our people are scrambling to find yet another bed where we can have a nurse at the bedside who can take care of a patient. It is not fun to know that if we were not able to do it, where would we take those patients? Can't send them to Green Bay, can't send them to Wausau, can't send them to Milwaukee. If we can't keep them here, then what do we do? And the other thing I would say is, while COVID is alive and well and wanting to find their next host that they can infect, we still have people in this community that are not with COVID that we have to continue to take care of. People are still having heart attacks. People are still having trauma. We've had one of our busiest trauma seasons this summer. People are still having strokes. People still need surgeries. Today is Breast Cancer Awareness Month. Our women in the community still need mammograms. How are we going to continue to do that and serve the people in our community if we don't do something different to stem the tidal wave that is already here and potentially could get worse? So I'm not trying to overemphasize anything. These are just the facts on the ground today. And as I hear from my colleagues across the state, every single one of them is saying exactly the same thing. So more than anything else, I worry about our people who've been in this pandemic, serving each and every one of us for the last 6 months. And we have a lot of more months to go yet to be able to continue to take care of our community. And then we have the flu season coming upon us on top of that, and then the winter, and then we will be all inside, and then the chances of potentially getting infected goes up further. So my hope is that we can have that leader adult conversation together. My hope is that you listen to the presenters that are going to be presenting some information and data and perspectives to all of us. And then my hope is that at the end of this conversation, we can try to understand what can we do as a community to really change the future quickly, before we get to a point where it becomes extremely difficult to move things in a different direction. So with that, I'm going to turn it over to, I believe, Megan, it's Frank Mellon.
To Frank, yes. And Heather, if you could advance 2 slides, please.
And I'll come back towards the end. Thank you very much.
Thanks, Dr. Andrabi, and good morning, everyone. I just want to help put some facts and figures to what Dr. Andrabi just shared. So we'll move through it quickly because I know we have a lot to cover, and I know all of you watch the news and so on, and you're keeping track of things yourself. So Heather, if we could advance. Here are some of the headlines. We'll move through these quickly as well. Positivity, the testing positivity in our area is approaching, some days actually exceeding 30%, with positive cases surging in all 9 counties. We're in Harvard's red zone in terms of how they measure, and we can get into that a little bit in a minute. But we're the hottest of the hot at this point, and positivity of 30 is it implies extremely widespread growth of the virus. Second point here to make is, and I'll definitely explain this later, but we run models to keep apprised of this. We're trying to stay ahead of this, be proactive, planful about our preparedness and so on, and to communicate some of these facts and figures to the community. And what we've noticed is a significant uptick in R, which is the reproduction rate of the virus. Again, I'll explain that more in a little bit, but our R reproduction rate for this virus, for this virus, the natural reproduction rate is 2.4. We've been running for about 180 days at about a 1.2, which means the community has been behaving in ways to suppress the virus through social distancing, masking, and so on. An R of 1.2 versus an R of 2.4 sounds like a small difference, but it's a massive difference because everything's based on sort of exponents, and the difference is geometric when you think about it. If we continue at this new reproduction rate of between 1.4 and 1.6, our earlier peak census of 60 now goes away, and we become in the range of 178 to nearly 300 in terms of COVID bed demand over the next few weeks. So this is a serious threat to not only our capacity and our ability to serve, but it's also a threat to the whole community in terms of that kind of load on not only the hospital, but the load on businesses is tough because you'll have more positives and so on. That implies more positives in your business. Heather, can we advance? So this is just a graphic representation of what positivity has done over the couple hundred days progression of the virus. What you see is positivity on the vertical axis and days that we've been tracking this on the horizontal axis. And you notice positivity was 5% or so for the first 160 days, 170 days, and then a rapid surge upward now into the 30s. We can advance. And then if for those of you who like pictures, when I talk about pervasive, and I'm sure many of you have seen this already, so we won't linger, but this is, again, on the Harvard scale. The red is the hottest, and we are that in this part of the state and this part of the country. So we can advance. So as we do this mathematical modeling, and as I said, I get into a little bit more description of the reproduction rate. What you see here graphically is, again, on the vertical axis, you see the number of new positive cases per day on the vertical, and this is the progression of time over the last, well, going forward actually, and since the first couple hundred days of the virus. I kind of truncated it here just so you can see that we were on a trajectory. Basically, the community, the 9 counties, was on a trajectory of this blue trace, which was implying that we would hit a peak of about that implies about a peak of 60 COVID beds demanded of our community. And I'll get into that a little more in a second on the next slide. But all of a sudden, in the last 3 weeks, an upward, thanks. With a surge upward of well beyond 100 cases to 300, 400, now 500 and 600 cases. This is a moving average, so we're seeing up to 500 and 600 cases per day right now. We've now basically put ourselves on a new curve. And this new curve implies that the behavior in the community has changed, because the virus, as I said, the reproduction rate for the virus is a constant, 2.4. How we can moderate that virus, we can take that number down from 2.4 to some other number. We were running around a 1.2. One other little fact for you. At an R of 1, the virus becomes in equilibrium. It starts to shut down. Below 1, the virus goes into decline. Above 1, as you can see, the virus grows. And much, much above 1, it grows more rapidly. So we at least need to recover the behavior set we were doing when we were on this 1.2 trajectory, because that was allowing us to keep our businesses open, not overrun our hospital and our healthcare workers. This trajectory will peak 700 or 800 cases per day, and now we can advance. Thanks, Heather. Here, the prior graph now translates to beds. This is the bed demand for the region. Again, same axis, days here, vertical here is beds in this case. If we look at the black jagged trace here, peaking right now at 110, that's total bed demand for the region, for the 9 counties. If, again, selfishly for us, we look at the magenta because that's the portion that we're serving in the community. And so we're trying to track and understand how that affects our hospitals. But overall demand on the region will be, we're now probably looking at 114 in the rearview mirror. That's not going to happen. We'll exceed that. We believe that right now, even if we were to shut the virus down rapidly, we'll be at a bed demand of nearly 180 in the next few weeks. The issue is we're concerned about is if we don't do something to shut the bed demand down or the virus down, we could start toying with this 287 number. It's definitely in the realm of possibility right now. Therefore some of this meeting. So I think that's the essence. There's probably some questions. We'll wait till later. And I think I can transition. I think there's one more slide and it basically says, hey, the virus is on the move right now. And I hope that's clear from the slides and data I shared with you. Back to you, Heather and Megan.
Yeah, so I'm going to turn it over to Kurt Egebrecht.
Yes, good morning, and thank you, ThedaCare, for pulling this meeting together and hosting this very important discussion. And I just want to echo Dr. Andrabi's comments that the time for action is really now. And if you could advance the next slide, please. What I really hope to cover today is just to demystify how the state of Wisconsin and local public health departments do the rating and the explanation on the state website about what categories we're in. And I think you'll find through that conversation that supports what Frank just went through in terms of the rapid rise of cases that we're seeing. And then I just want to touch a little bit on future challenges that we see from a public health perspective and how that will impact both the rates within the hospital throughout the region. So with that, I'll just go to the next slide and share with you a little bit of how we're seeing and tracking this, just using Appleton as an example. And on the x-axis here, you'll see that we had our first case back in March here in Appleton, and the blue bars represent the weeks and the total number of cases that occurred in that week. And when we look at this, we see some insights that I think will be helpful to note that shortly after July 4th, we saw a change. And I think what we saw was that people were gathering with others outside of their household membership on vacations and other events surrounding that holiday, where we saw a rise in cases. And then we were hopeful. We began to see a reduction during that time frame for a couple weeks. But now as you look forward and you look at Labor Day and schools reopening and really Packer games and the impact that has on people gathering, we're seeing a very fast acceleration, as Frank just described. And if you look just in the last 3 weeks, that's about a third of our total case counts, just in these last couple weeks. The last 2 weeks, in fact, is about a third of our caseload. Next slide, please. So to demystify, how do you compare one community or one county from another or one state from another? And as Dr. Andrabi said, we made the top 5 list. I think we're in the third now, top 3 in the country. And how we do this is we do it by putting a discussion to burden, which means per 100,000 people, what is the extent? And for communities to arrive at that, you take a two week of your case counts. So for Appleton, 2 weeks ago, we had 215 cases. This past week, we had 340. That brings us to a total of 555. We divide that by our population and then multiply it back by 100,000. I think it's important too to recognize that these numbers are only lab confirmed cases. And so that means we don't capture every single case. We only count those that are lab confirmed. We have to assume, and we do, that there are many more cases that don't get tested. Many times when a family member is tested positive, others in that family that become ill don't get tested because it's assumed that they'll need to be in quarantine till such time that family member and others in that household are better. So this is an underreporting, nonetheless, an extremely, extremely high level. What the state then does is they put it into categories based on your equal burden of low, moderate, moderately high, or high. And yesterday they came out with a new category of very high. And very high is 350 or greater, which, as Frank described, mirrors the Harvard model as well. Next slide, please. So to kind of distill why two measurements are important, the burden that we just described is important, but so is the trajectory. And by that, I mean, are the case counts growing? Are they shrinking, or is there no change, relatively no change? And from that, if you follow your eye down to the lower right corner of this graph, you'll see that we are certainly growing, and we certainly are in the very high category now. So we would be in that bottom right, very high category, not just in Appleton, but throughout our entire Fox Valley region. So I know this was a quick conversation about how we arrive at that, but if the next slide will show you then how just one community, if you could advance it to the next slide, through time, you'll see how we have gone from low to moderately high. And now the last 3 weeks would be into the new category the state is now calling very high. So we are at a very critical moment in where we are in terms of seeing the future, because these cases, obviously, when you increase the numbers, the odds of people needing medical care and hospitalization increases as well. I want to transition to a little bit of what I see as challenges from a public health perspective. Dr. Andrabi touched on one, is the cold and flu season is just around the corner. But I think it's important for you on this group as community leaders to understand the capacity that public health has been under. And we're having some stresses with that. The disease investigation and contact tracing that is done by public health is really being challenged. These numbers that we're seeing are not sustainable. We've doubled through federal grants, we've doubled our workforce. We brought in non-public health people to help with this, but we are at a point where health departments across our region are really becoming stressed. And why that's important to know is without rapid identification of those who are positive and getting them into isolation is a critical step of preventing the spread of this disease. So just as hospitals are becoming strained, you need to know the public health system is also being strained significantly by this large jump in cases. I think we have another challenge in that we've been able to augment much of our testing with the National Guard. The National Guard is only going to be with us for 10 more weeks, and that funding has then expires. So we'll lose a very critical asset to our testing, and without the testing, we won't know who then to isolate. So that is a concern that we're looking into the future on. So I think in closing, I just want to share the message again, and maybe the last slide will kind of bring some focus to what we're seeing from a public health perspective is that early in this process, we were getting really good compliance. I think people internalized that this was a new novel virus and were taking appropriate steps to protect themselves and their families. I think over time, it's human nature to desire social interaction. And I think we've had a little bit of COVID fatigue where they have taken a few more risks and they're venturing out of their household members and going into gatherings that put them at greater risk and spread of the virus. And I think if we all honestly took our phones out and looked at our Facebook pages, you can visually see that in what people are posting. You can look around the community and see it. When there's a Packer game, the bars are packed. We don't have to wonder why it's happening. We see it. So I think what we can share with our contact tracing is people don't necessarily purposely go out and spread this virus, but this unique novel virus, there's many people that have very mild symptoms and they're not being tested. And so therefore they don't know themselves that they're ill. And so they're still doing their day-to-day activities and spreading the virus. And that's especially true with the youngest people. They have milder symptoms, and so they don't necessarily know to stay home. It's not intentional, but nonetheless, they can shed the virus and they can spread the virus. And so that's why we're looking at different targeting messages for different groups. But nonetheless, collectively as a community, the only way to bring this back down is to do the things we know that'll work. And those steps will be talked in more with other speakers today. So thank you for the opportunity to share a little bit today.
Hi, this is Becky Bartosik with the Fox Cities Chamber of Commerce. Unfortunately, I am in complete agreement with Dr. Andrabi because for the past 2 weeks, I've been on nonstop calls with organizations across the country as well as locally. And the attention that we're receiving is not the attention that we're looking for. We're on a list we don't want to be on. And I can tell you when I'm talking to members of chambers across the state, they're not actually saying the same thing. They're actually pointing out, wow, the Fox Cities is really a hot zone right now. There's a problem over in the Fox Cities. So from the business perspective, our biggest challenge since 2013 has been attracting talent to our region. And we're in a unique situation right now because the pandemic is forcing people who live in larger communities to really explore potentially living in smaller communities like the Fox Cities has to offer. So when we're not getting the visibility that we want, and when Good Morning America and national coverage is showing us as a hot zone, it's really not helping us. So if you could go to the next slide, please. When we look at the financial impact that COVID is having on our region, it will be years before we can really completely understand the financial impact that has happened. But there was a survey that was completed by the QTI group last week that does give us some information that's very important. If you look at the red bars, these are severe negatively impacted business categories. As you see, hospitality and food services are a hotbed right now. Arts and entertainment and recreation are also hugely hit. Now, when we look at bringing new businesses and we look at attracting talent to our region, what do we brag about? We brag about our airport. We brag about the PAC. We brag about the Timber Rattler Stadium, the Expo Center, the Champion Center. We're really driven by large events. So the longer that this goes on, the more this is impacting really organizations that drive our region forward. Next slide, please. So important facts to know. COVID-19 is having a huge impact on our tourism economy. As of August 2020, the Fox Cities region in Oshkosh has the second lowest hotel occupancy in the state. Only Madison is lower. Now that's for a number of reasons. There is concern about safety traveling here, and we are primarily driven by large gatherings. Hotel revenues are down almost 53% from last year. Now, how does that really impact our community overall? Because it's not just the hotels that are being impacted. The room tax that is collected by those hotels actually funds our very successful Tourism Convention Bureau, and it also pays the bonds on the Fox Cities Exhibition Center and the Community First Champion Center that help attract people to our region. Next slide, please. And how does it actually impact our individuals? Most of our hotels and tourism businesses are not quite back to 50% of staffing. This Monday of this week, the Tourism Convention Bureau reached out to a group of 5 diverse different hospitality businesses, hotels, just to find out where we are this week. And you can see from the numbers here, as of March 1st, those 5 hotels employed 369 employees. Today, they employ 132 employees. 16 of them have been temporarily laid off, and we have 218 employees, people, families that have been impacted by permanent layoffs in that industry. The tough part is, when it's impacting the entire industry, there aren't places that are readily available for work for them. You can't take someone that's a fantastic housekeeper or a bartender or a front desk clerk and know that they're going to easily transition into a manufacturing role. It's going to take some time and training to make it happen. So from the employer perspective, if you look at prior to COVID, 3.6% of the workforce was only working remote, half-time or more. Now we're looking at 62% of the workforce is now impacted by remote work. Next slide, please. Other things that have changed. As I mentioned before, since 2013, our largest challenge has been to attract the right workforce. According to the survey that was completed last month, our largest challenge as employers now is in enhancing employee engagement. And of course, that ties to our folks working at home, having the new challenges of their kids doing virtual learning, and making sure that we keep our employees engaged during a crazy pandemic time. The second most important focus for them is the health and safety measures. And then we're back to talent attraction back from 2013. So things that we've done, moving on to the next slide, please. Some of the things that employers have changed are we've offered flexible hours, enhanced work remote options, expanded virtual programs, added sick time, and a number of other things. These are the things that we can control. And these have helped, they did help in the beginning. But the biggest challenges that are not readily addressed are the fact that our businesses are very concerned about liability, what happens when someone comes into their business and gets sick. And our businesses are also very concerned that they really have no control over what our employees are doing when they're out of the workplace. We can't mandate that people wear masks when they're not at work. We can't mandate that they do these things. But as employers, I do beg of all of you, please make sure that we are complying with the contact tracers when they reach out to us. Ask our employees to do that. And please urge our employees to follow the guidelines, wash their hands, wear a mask when they're outside of the workforce or workplace. If anyone has a chance of individuals listening to them, it will be their employer, because truly we need a community that will be safe, smart, and open for business.
Good morning, everyone. I'm Judy Baseman, Superintendent of the Appleton Area School District. And this morning, I appreciate the opportunity to speak on behalf of my K-12 public education colleagues, the superintendents of the Fox Valley region. Next slide, please. And you can go one forward, please, again. So every school district in our region, large and small, is working toward the same end. A good year of learning that emphasizes the academic and social and emotional needs of our students in a way that also prioritizes their safety, as well as the safety of their families, their staff, and the greater community. As school leaders, these are the core values that drive every decision that we have had to make and that we make going forward. No matter what learning model a district is in, whether in person, fully virtual, or a hybrid of both, it's clear that there is nothing normal about the current K-12 learning environment this year. Next slide, please. We are in the midst of a global pandemic, and right now, we all know that cases are surging in our community, our region, and our state. While it's true that every district is facing many of the same challenges, it's also important to note that each district and each community is unique, and a one-size-fits-all approach simply does not work. There's no single playbook that we can turn to address the individual needs of our schools and our communities. We collaborate regularly as Fox Valley District leaders and continue to learn from and to support each other. We are all doing our very best to navigate the multitude of challenges that we are all facing. Next slide, please. Now more than ever, school districts are relying on their partnerships with others in the community as sources of knowledge, strength, and support. For example, city and county health officials who help guide us in making those tough decisions to support the health and safety of everyone in our community. Our healthcare partners, such as ThedaCare and others, who are working in collaboration with districts and health officials to respond to the current health crisis. In addition, many outside programs and partners have stepped up to help us to support our families, our students, and our staff in a wide variety of ways. In the Appleton Area School District, for example, some of these programs include the Boys and Girls Club, the YMCA, United Way's PATH program to provide telehealth, and the Appleton Education Foundation, the Community Foundation of the Fox Valley region, and Lawrence University, to name a few. We are so grateful for all of the many ways that individuals and organizations have offered their help and their services to support our kids and our schools in such a challenging time. We are reminded every day how fortunate we are to live and work in such an amazing community. Next slide, please. And the next slide. We all long to return to normal. We want nothing more than to see our schools and our classrooms filled each day with happy, excited students and staff, learning and growing together. This is the ultimate goal for all of us. In order to make that happen, we need your help. If we work together as a community, we can change the rate of transmission and slow the spread of the virus. We can make it possible for our kids to remain in or return to our classrooms and schools, where teaching and learning are at their very best. We can make a difference together. We need your collective voice to support those efforts. And we embrace ThedaCare's encouragement to move forward safely together. Thank you.
Tom? Are you on?
Can you hear me now?
Yes, we can.
Okay, I'm
Thank you.
muting me. So my name is Tom Nichols. I'm the Vice President of Medical Affairs for Ascension St. Elizabeth's Hospital in Appleton, and also serve as the Surge Section Chief for all the hospitals in Ascension, Wisconsin. You can go to the next slide. So here at Ascension, we start all our meetings with a reflection, and chose this photo of our caregivers at Ascension St. Elizabeth's as today's reflection. These people represent the people that everybody in this room expects to be there when they need medical services, and they continue to be there for us. But we need the community's help to stop the spread of COVID. And you can go to the next slide. So we've been preparing for the surge since March. All of our sites of care, including St. Elizabeth's, Mercy, and Calumet, spent significant time and energy making plans to respond to the needs of the community we serve. The leaders of ThedaCare, Advocate Aurora, and Ascension decided early on that we were going to take a collaborative approach, that we were going to share knowledge, and we were going to update each other on how things were going, what we were learning in order to meet the needs of the community. We planned for space. We planned for having extra equipment like ventilators, extra training and care protocols for our staff, systems to bring in additional help like staff and resources and PPE. And during this time, we've been able to share our staff with other surging sites around the country. So we've sent staff from our hospitals to Texas, to Florida, to Arizona, to help those sites respond to the surges that they were seeing in their community. Next slide. So while all our sites of care have prepared surge plans to adapt to the needs of the community, the rate that the virus is spreading, which Frank and Kurt went into good detail about, is deeply troubling to our healthcare institutions. We are experiencing a significant increase in the number of staff who are unable to work due to community exposure, positive COVID-19 tests, and a child at home with a COVID-19 infection or exposure, which requires the parent to be at home with the child. In other areas of the country that surged, which were primarily urban areas where there were more pockets of infection, staff were not as heavily impacted as they are in smaller communities like ours. That's made it really challenging for us to respond to the rapidly growing rise in hospitalized patients. I walk through our COVID units at the hospital every day, and given the safety protocols, which are extensive in the hospital, as well as mandatory masking protocols in the hospital, I feel safe walking through those units, that I'm not putting my healthcare in jeopardy. I don't always feel that same level of safety when I'm out in the community, or when I know that the staff that works for us is out in the community, because some of those same safety protocols are not happening or are not possible. While we try to bring in additional staff, all the regional hospitals are surging and facing the same issue, and there are fewer available people around the country as more places have resumed normal operations than earlier in the pandemic. We've also had to limit visitors at our sites of care to limit possible exposure to COVID-19. This is not a decision we ever want to make, but right now it's one that's necessary due to the extraordinary community spread. As Frank and Kurt have already said, if the cases continue to rise at exponential rates, we'll likely be forced to reduce or eliminate some non-emergency services like we did this spring, or transfer patients out of the area and possibly utilize a field hospital in Milwaukee. That's a last resort, but it's very real if we don't get things under control right now. And that's going to take a pretty dramatic change in what's happening in our community. In Green Bay, we were already seeing patients lined up in hallways, and I could imagine that could continue, that could happen in other areas of the state, including the Fox Valley. I would say if you're waiting for, or if you have been waiting for an alarm bell to go off, that's where we're at now. We're approaching the last point of making dramatic changes to avoid a crisis in our community. We know people are getting COVID fatigue and are tired of hearing us talk about mitigation strategies, but we really haven't had a major curve to bend until now. Now is our time to bend that curve. We heard so much about that in March and April that people stopped listening. But the graphics that were shown are what we were seeing in the hospital, and we need a shift in public behavior in order to bend that curve so that we can continue to meet all the healthcare needs of our community. Next slide. This is not a hospital problem, it's a community problem. The health systems can respond to what's happening in the community, but we can't solve the problems alone. We need community action and community awareness of what's going on. We need everyone to take this seriously to slow the spread. So that means washing your hands, social distancing, and wearing masks in public. It means getting a flu shot so we don't have a twin pandemic in the hospitals. If we all do this, we can protect ourselves, our families, our neighbors, our businesses. And there's some additional information about COVID-19 and Ascension resources that are on the screen. Thank you.
Thank you, Tom.
Hello, I'm Dr. Michael Hooker, Chief Medical Officer of Acute Care for ThedaCare. And in ThedaCare, we've gone through a lot of the same exercises that Dr. Nichols mentioned. In March, starting up an incident command to deal with our impending pandemic. We made significant changes to our visitor policies. We formed a medical branch within the incident command deal with a lot of the medical questions that were coming up on how to deal with COVID, how to treat it. And at that point, there was just not a lot of information. So we pulled together a group of infectious disease, infection prevention specialists, clinicians to help guide the organization. We also made extraordinary efforts to obtain PPE and supplies, everything from the masks and cappers, pappers to gowns and gloves that have seen a significant increase in use. We fortunately, over the past several months, have been able to obtain more and are in a good position with our PPE for the health system. Another group that we formed out of the incident command was a surge team looking at how we would prepare and maximize our bed capacity, both physical bed capacity and care delivery capacity of our staff. We had a stepwise approach where we cohorted patients or grouped COVID positive patients on one unit that was negative pressure and had a plan to open up additional units. We expanded our negative pressure rooms throughout the health system at both the TCN, TCA campus, as well as in the critical access hospitals. 2 weeks ago, we were at a point where you can see the lines on the previous slides where our volumes were increasing. So not only did we expand our COVID cohorting units at TCA and TCN, we also started keeping COVID positive patients in all of our critical access hospitals to try to keep those patients that were medically appropriate at that level of care to try to preserve bed capacity in our two main acute care hospitals. The point has been made several times, but our staff, our healthcare workers, are part of the community, and our community is getting sick at an extraordinarily high rate. When we see these numbers and graphics that show 30% positive rate, or we have 250 staff out, we're only seeing the tip of the iceberg. There are a huge number of patients that are not seeking medical care, that have mild disease, but it's really impacting our healthcare team because they're getting sick, they're having to quarantine, be in isolation, they're taking care of family members. So as we've said, and we'll continue to say again and again, we really need to rally the community to control our community spread, to help protect our healthcare workers, which are doing a phenomenal job, going above and beyond. But we need to do our part in protecting them so they can take care of us. So that's our ask, and that concludes my portion. Thank you. You can go to the next slide.
Good morning, everyone. I'm Mark Cockley, Chief Clinical Officer at ThedaCare, and just like to go over some other things related to COVID as far as some of the science behind. So go to the next slide. One thing looking at this, and I look at the list of people here, there's over 170 people, community leaders from our region. And I think right now we all feel about the same. We have little control of what's going on. We know what needs to happen. We know what we can control in our own environments, but there's so much that needs to be controlled outside of our direct control. And I think a lot of that is how do we set that example? How do we communicate the message to do the right things and understand what's going on? I mean, looking at the science, a lot of what's there is what's been discussed: masking, distance, hand washing, things help reduce the spread of the disease. You know, so that's a very important aspect here. Go to the next slide. And looking at this early on, and this is a novel virus. It's something that hadn't appeared until December, and it's really progressed its way around the world rapidly, and it's been evolving, and we're learning as we go. Here's a study from Massachusetts General Hospital, and I think one of the questions in the chat was, what is the infective rate in our hospitals and with healthcare workers? And you can see really before masking, it was only 1%, 1 in 100, but when you're looking at 7,000 people working in the hospital, that can be significant. And Dr. Andrabi said at ThedaCare, we had over 200 people today not show up for work because of symptoms or COVID exposure or COVID positive. When we instituted universal masking, it cut down to half that, to 0.4, 0.5%. So really making good progress. If you look at the number of people we've had as employees infected, majority of them are community acquired. So it's being out in the community. And this was said by others, and the nurses that, Dr. Andrabi quoted, hey, I'm doing all I can in the hospital to prevent this, but when I'm going out to the grocery store, when I'm going out for the essential things I need to do, that I'm at risk, more so when I'm in that high infective area. So something to really keep track of, and how do we do this? Next slide. And here's an example. This is a study early on where there are 2 hairstylists in Missouri that were positive, and they continued to work. But they did, well, maybe not the responsible thing by continuing to work, but they wore masks and did things that could help prevent spread. There were 139 people that they did hair on, and that's a fairly close contact aspect. But by wearing masks, there were no symptomatic cases reported, and of the people who tested, none of them were positive. So again, evidence that wearing that mask makes a difference. Washing hands makes a difference. Next slide. Here's another example of how masking helps. If you look at this graph and you look at the fluorescent green lines towards the bottom, those are areas where universal masking is culture. So you can see as things happen, they had fewer number of cases, and they didn't peak as much, and it was more of a drawn out aspect. But fewer overwhelming healthcare systems, fewer people at one time getting hospitalized, so masking does make a difference in those. You can see it, there are a couple light colored yellowish ones that you can't really see, where early on, before March, they introduced universal masking. And you can see that in Australia and Czechoslovakia, and those, you can see those where they went up a little bit higher, but they did taper off. And the gray ones are people where there's no masking or their recommendation came late. And unfortunately, a couple of those names got cut off, but the United States is one of those. A lot of the European nations are some of those. Those are the high peaks that we're still growing and escalating throughout. And you can see this is only 60 days into the onset. So this is a little bit old data, but that's trying to still evident. Next slide. Looking again at masking, how we look at this is a little bit of a complicated graph, but if you look at it, and what is on the left axis is effectiveness of masking. And as you go to the right is the percentage of the population that are wearing the mask. One thing that Frank mentioned early on is that R factor, the replication rate. And if you see the little graph on the right-hand side, blue is replication rate very low, 0, under 1, meaning the incidence of the disease is decreasing in the population. More red, higher replication rate, more disease. So if you look at the graphs on the left, where people were wearing masks all the time, along the bottom actually, wearing all the time. So the more people that wear the mask and the more effective that masking is, the more blue you see as that graph goes up to the right and to the top. And that's where we want to be. More effectiveness of the mask and more people wearing it 100% of the time. Effectiveness of the mask is, one, is the material it's made of. A good filter doesn't have the valve, so it doesn't let the air escape freely. And also that it's covering your mouth and your nose, not just your mouth, because the virus is spread in respiratory secretions, fine droplets. So the easier it gets out, further it goes out, the more likely it is to infect somebody. And then if you look at the bottom 2 graphs is where people are wearing masks all the time, versus the top, people just starting wearing the mask after they develop symptoms. And you can see across the top 2, we don't really get to that blue aspect. So really the cat's out of the bag already. They already have spread, and they're already spreading it. So more people are infected, longer infection process, more people hospitalized. So this does show the sooner you start wearing masks, the more effective the mask, and the more you wear it, the less symptoms, less spread of the disease that's there. And again, there are new studies coming out that really show this, and some the contact tracing done and investigations in other countries. We're looking at a recent study out from India that 8% of the COVID positive people result in 60% of the new cases. So the aspect of super spreader is out there, but it's not because it's a physiological difference of that person, it's that behavior of that person. I don't have symptoms, or I have mild symptoms, so I'm just going to do what I want. If you're in the study, it also showed that if you're with someone who's positive and you're within 3 feet of them for an extended period of time, you have almost an 80% chance of getting COVID. Versus if you expand that up over 6 feet and it's less time, it's down to 2%. So just doing simple things of that distance, wearing a mask can take your risk from 80% down to 2%. So very significant. So really, you know, as I was preparing for this, looking at it, it is a silent disease. We don't see it. You can't, for the most part, tell someone's there. It's almost like, I relate it back to my time in the Navy. It's like radiation. What we need, time, distance, and shielding, right? Shielding, face masks. We need hand washing, which shields you from it. Distance, the further away, less your exposure, less your risk. And time, less time you're around someone. You're being outside in open air where that air exchange in environments in the building where there's more air exchange, the better. So closed environments, less airflow, closer contact, more people are getting infected, and one person can make a difference because it can be 60 or 80 cases if you're all in a room together for an extended period of time. Next slide. And I think that's all I have. So Megan, back to you.
Yeah, thank you, Mark. So thank you all to the presenters today. I think we heard some really enlightening information and some solid takeaways for us. So I want to just bring us to a close here, and I'm going to turn it over to Dr. Andrabi. But I think it's clear that together we have a powerful voice. Working with the schools and public health, we've created that theme, Forward Safely Together, as Judy mentioned. And I think we have a real opportunity. Next slide, please. So we always look at consumer research to guide what we do from communications and marketing perspective, and we know that we do have the power here today. We have the right people here today who have influence over people who don't wear masks, doctors, friends and families, employers, hospitals. Next slide, please. And we also know that from our research that effective messages do exist, and there is a way to reach people who don't wear a mask or are reluctant to do so. So economy is one, and Becky talked about that today, getting kids back to school when we talked about that today. So I think we have the messages and the team to work moving forward. Next slide. So ThedaCare will provide ongoing regular communication to this group as we have been doing, but we'll provide specific actions that you can take with your stakeholders to help turn this tide so we can move forward safely together. We'll be sending out an email today with a short survey asking you 2 questions about specific actions your organization will take and the kinds of information and resources that would be helpful to you. Also encourage you to visit besafewisconsin.org. There's a lot of content and information on that site that is shareable, and we'll continue to enhance that. So with that, I'm going to turn over to Dr. Andrabi.
Thank you, Megan. And thanks to all the presenters for just doing a wonderful job of putting all the pieces together. I am so appreciative of the fact that all of you have taken the time to be here and listen to this conversation. What I would leave us with is no one of us can do this on our own. None of us can do this on our own. What I would leave us with is, I think you have heard, and I'll just translate it, is I'm sounding the 3-alarm fire for all of us. This is just me speaking. And if we don't do something differently, in the next few weeks, we are going to be in a 5-alarm fire. The other thing that I would leave us with is to say, this problem will not be solved inside the 4 walls of hospitals. We won't be able to do it. So this is where the community that we all live in, our families are in, we work in, we love, we as a community will have to come together with all the things that you have heard to actually flatten the curve and reduce the burden with respect to the people that end up in hospital beds. The solution is not more hospital beds. The solution is the simple things that everyone has already talked about that we need to make sure that we do effectively, all of us. And you've heard that it's, if some of us do it and some of us don't do it, it doesn't work. If all of us spread the message and if all of us come together and make sure that we do the simple things, we have a chance of making sure that we can trim the tide and we can ensure that we don't have more people needing hospitalization and ICUs and ventilators, and hopefully we can actually impact the mortality from this virus. When I think about the number 206,000 and growing, each one of those represent a person, a family, an extended family that have been tremendously impacted by the effect of this virus. When I think about the 250 people at ThedaCare that couldn't show up to work today, that could be the entire workforce at a critical access hospital in one of our communities. And then we can't provide care. None of us want to be there because, you know what? I'm a patient. I could be a patient. My wife could be a patient. My child could be a patient. My mother could be a patient. And so my appeal to all of us together is, let's make sure we get together. Let's make sure we spread the word. Let's make sure that we get the right information in front of people. And we have the ability to be able to flatten this curve. We've done it before. We can do it again before somebody else steps in and does something to us. So thank you all very much for being here. I hope this has been helpful. We will continue this dialogue and make sure that we continue to communicate with you, as Megan said. And I hope you all have a wonderful day. This has given you some things to think about, and let's move forward and create some action out of this. Thank you all very much.
Thank you. We'll be in touch.